Dr. C from EPPP with Dr. C, and today I am sharing my tips and tricks when you are answering questions about substance use disorder on the EPPP. I find that a lot of folks really struggle with these questions. Many people don't have a background in treating substance use disorder or working with this population. I will say, as a disclaimer, it's one of my favorite things to treat. I do have a background in working with substance use disorder. However, I have created kind of a methodological way when you're getting a vignette on the EPPP, breaking it down, looking at, either some statements or symptoms that can clue you in and really help you answer those questions accurately and efficiently. Let's check it out. So the EPPP is going to give you probably a vignette or two or three, regardless, that really demonstrates and describes a person who is displaying signs or symptoms of a particular substance, and it's either intoxication, meaning they ingested the substance, or withdrawal, meaning that the body has metabolized the substance and there are physical withdrawal symptoms. So these vignettes can be really tricky. However, these are one of the things that I like to do, like in terms of breaking it down, questions really to ask yourself. So the first thing is to really look at, am I cluing into this question about intoxication or withdrawal? So I'm in one of two camps. So are they describing someone that is actively under the influence, intoxication, or is it someone who is experiencing withdrawal symptoms, the substance is leaving their body? Then the second question I ask myself is, the way that the vignette is describing this person's behavior, are they describing an increase in that person's energy or a decrease in that person's energy? And that's going to help us clue into what substance are they maybe trying to describe. So an increase in energy, I'm starting to think about stimulant intoxication, sped up. Decrease, I think I'm more in the opioid land, maybe cannabis, maybe alcohol use. However, decrease can also be the opposite of stimulant intoxication. So what goes up has to come down, and it can be stimulant withdrawal. Finally, there's certain characteristics that are described in the vignette that can clue me into the substance at hand. So I will go explain that in the next slide. Alrighty, so first thing I look at when I'm reading a vignette, are there any type of behavioral characteristics or anything that's being described that can really help me grasp what they're asking? So one of the major things that the vignettes they like to include, they like to talk about eyes. They love describing the eyeball. And so here are two things that really help me when I'm breaking down these questions. Do they describe someone's pupils? So if they are describing dilated pupils, I know I'm talking about stimulant intoxication. If they're talking about constricted pupils, meaning really the pinpointed pupils, I know they're probably talking about opioid intoxication. Other ways that they talk about eyes, eyelids, so drooping eyelids, kind of slowing down behavior. Slow, I'm in maybe opioid land, maybe alcohol use disorder. So especially drooping eyelids, that tends to clue you in opioid use disorder. Reddening eyes, cannabis intoxication, and then watery eyes, and we talk a little bit about this later on, opioid withdrawal. So opioid withdrawal really looks like the worst flu anyone can imagine. Watery eyes, opioid withdrawal. Next, we're going into other behavioral characteristics. So heart rate, increased heart rate. If you hear any of that or see that in the vignette, again, increased, sped up, stimulant intoxication. Decreased heart rate, slowed movement, things like that. We know we're talking about maybe depressive feature. So sedatives, hypnotics, maybe alcohol. Reaction time, again, if it's slowed, it's probably in the depressant land. So alcohol, cannabis, opioids, sedatives, hypnotics, and then increased, again, reaction time, increased, stimulant. So methamphetamine, cocaine, caffeine. And then finally, this is a really big one that tips me off, gait. So gait is used to describe how someone is walking. Unsteady gait, probably depressive related substances, so sedatives, hypnotics again, alcohol also, opioid maybe with slowed gait, and then pacing, so increased, rapid, fast walking, stimulant intoxication. Alrighty, so another clue, speech. Does the vignette describe a certain type of speech pattern? Rapid speech, again, increased behavior, stimulant intoxication. Slowed speech, depressants, sedatives, hypnotics, and then really a huge one, slurred speech. We're probably looking at alcohol, maybe opioid intoxication or sedative hypnotics. I would really hope that they don't give you a question to trip you up like that, where it's slurred speech, alcohol, opioids, and sedatives or hypnotics, because kind of falls into all those categories. However, I would say 9 times out of 10, slurred speech tends to be associated with alcohol intoxication. Then we're looking at appetite. So if the vignette references lack of appetite, they're not eating, they haven't had anything to eat in a couple days, stimulant intoxication. So methamphetamine, cocaine use, potentially nicotine intoxication, but not for a couple days because nicotine is an appetite suppressant. But that's what this question's getting at, is the appetite is suppressed. Typically we're in stimulant land. What about increased appetite? So similar to what I said previously, what goes up has to come down. With stimulants, if when you're intoxicated on a stimulant-based, substance, your appetite is no more. When you're withdrawing from the stimulant, the appetite goes way up, so increased appetite. The other type of substance that can be associated with increased appetite would be cannabis. And so that would look like cannabis intoxication. This is a category that I really call other behavior because it doesn't really fit into the other behavioral characteristics, but they're very specific statements about symptoms that can clue you into the substance. So with inhalants, I have seen EPPP questions really go in on skin irritation. So skin irritation around the mouth, around the nose, really has to do with how inhalants are ingested, so nasally or through the mouth. So skin irritation, you're probably looking at inhalant intoxication. Similarly, fluids expelled from the nose, probably an inhalant land. However, so with opioids, I really clue in and I narrow in on opioid withdrawal if they mention flu-like symptoms. So that is a huge hallmark, very, very specific to opioid withdrawal. And so if they're mentioning runny nose, fever, chills, anything that would look like, the worst flu of your entire life, we're probably looking at opioids. This next part, I wanted to walk y'all through how I answer these questions and how that prior knowledge can really, really help us when we're figuring out these vignettes. So here's an example of a vignette. A 42-year-old man presents to the ER claiming that bugs are crawling under my skin. He has not slept in 3 days, is highly agitated, and exhibits rapid speech and dilated pupils. Blood pressure and heart rate are elevated. So I see this question, and then I also look at the answers. A, cocaine, B, alcohol, C, cannabis, D, PCP. So taking that into account, I'm going to show you how I break it down. So looking at the vignette, I highlighted the things that stand out to me. First and foremost, bugs crawling under skin. So for those of you who have worked with this population or know kind of the health psych realm a little bit, bugs under the skin, very common, especially with methamphetamine use. It's also referred to as formication, and the M there is important because it is formication. So bugs crawling under the skin. I'm already thinking methamphetamine, but let's carry on. Not slept in 3 days. So lack of sleep, increased energy. I'm pretty sure we're talking about stimulants here. Highly agitated, again, increased behavior, rapid speech, increased behavior, dilated pupils, stimulant land, and blood pressure, heart rate elevated, stimulant land. So looking at the questions, cocaine, alcohol, cannabis, PCP. As you know, I was kind of thinking methamphetamine. but that's not an option. So what is the next best class of substance or type of substance that is a stimulant here? Cocaine. Cocaine is a stimulant. It is the best answer possible. Let's see if we were right. So y'all already know I knew the answer. I made this PowerPoint, so there is that. But the right answer is A, cocaine intoxication. I think a better answer would have been like stimulant intoxication. However, I don't make the test questions. And so that is really what would be kind of the best possible option there. Bugs crawling under skin, little sleep, agitation, rapid speech, dilated pupils, increased heart rate. This is stimulant 101. If you knew kind of the symptoms of stimulant intoxication, you would absolutely be able to answer this correctly. So next question, let's check this one out. A 28-year-old man is brought to the ER by police after being found running naked in traffic. He is aggressive towards staff, has a blank stare, and appears impervious to pain. His speech is disorganized, and he alternates between calm and explosive rage. So our options are A, ecstasy, B, cannabis, C, PCP, or D, alcohol. Let's check it out. Highlighting what's really standing out to me. So running naked in traffic, because that seems to be a bit of different behavior than we would typically expect. Aggressive towards staff, but here's what was interesting. Blank stare. And so I start to think it's almost like they're describing some type of dissociative state. And then here is the kicker. Impervious to pain. So meaning appears that they are not impacted by pain whatsoever. They might fall down and keep running up. I immediately know this is PCP. Don't know if anyone has ever seen any videos where individuals who are under the influence of PCP are either being chased by law enforcement or climbing fences, and it seems like they are not impacted by any type of physical pain. So if they are trying to, reprimand or, hold the person down, they just do not realize that most of us would probably feel discomfort or pain, and they do not. And so that's how I know it's PCP. The other tip-offs were speech is disorganized, and then this mood lability piece. So alternating between calm, cool as a cucumber, and explosive rage. This all sounds a lot like PCP. I'm not thinking ecstasy because typically that would have other buzzwords such as, excessive sweating or drinking water. Cannabis, the behavior would be much more slowed down. This person seems highly energized, and same with alcohol as well. Answer is C, PCP. So running naked, yes, that's some disoriented behavior. Again, running in general, that's an increased energy related activity. Aggressive, there's irritability, blank stare. So this was the dissociative piece. I don't love that they included that because that can kind of throw you off. But then calm to explosive, mood lability, and then finally the kicker was no pain response. That's how I know this is definitely PCP. Okay, last question. So a 48-year-old man is arrested for erratic driving. He has slurred speech, impaired coordination, and nystagmus. So based on that, does it look like A, alcohol, B, barbiturates, C, heroin, or D, PCP? So things that stood out to me about this vignette: erratic driving, slurred speech. So slurred speech, I'm thinking we're in depressant land, impaired coordination. Okay, so that's tipping me off to either alcohol use or barbiturate use. PCP, again, I may be erratic driving, but the slurred speech, I'm starting to think more so along the lines of some type of alcohol withdrawal. But what's tricky is this answer also has barbiturates, and barbiturates maybe could include a bunch of these symptoms. The kicker, though, is nystagmus, and I Googled this and it also said nystagmus. I'm not sure how to pronounce it. Nystagmus, that is how you spell that. And really what that's describing is when there is an issue with an impairment, particularly in the cerebellum. We're gonna like cross domains here. Someone who is under the influence of alcohol might demonstrate this symptom, meaning involuntary eye movements. So back and forth, kind of like all over the place, cannot keep steady eye contact, and that absolutely is a hallmark of alcohol intoxication. Not surprisingly, answer here is alcohol intoxication. We have the erratic driving, slurred speech, impaired coordination. Again, that's the cerebellum there. Nystagmus, basically eyes darting rapidly back and forth, uncontrollable movements. It's gonna be alcohol. Alrighty, so that really wraps up kind of our preview of one of the components of one of our subspecialties, substance use disorders, under our mental health diagnostics domain. Here's a little bit about our different products. So we have for purchase right now, PDFs. We have 3 types: outline notes, visual guides, detailed charts. We also will be uploading recorded seminars that you can purchase, recorded audio. We already have a couple free preview products in the PDF realm, totally free. You can just download them immediately. And coming soon, we're gonna offer some live seminars. So live seminars on a various, wide array of topics. And then also a couple Ask Me Anything, where essentially y'all show up and it's ask me anything about ethics, DSM, study tips. Just, I will not have a PowerPoint. I won't really have an agenda. You show up, you ask away, and we get it done. Any questions on how do you contact us? How do you follow us? We are all over social media, which is still hilarious to me because I'm learning as we go. I am not social media savvy at all. So you could visit our website, EPPP.drc.com. You can email us. I think that's probably the fastest way to get a direct response, EPPP.drc@gmail.com. Find us on Instagram. Find us on YouTube. We have a Facebook, and most recently, we have a TikTok. And the TikTok is, really picking up speed. So come join us. Thanks so much for watching.